I always say when we're doing snake awareness talks that snakes have saved a lot more lives than what they have taken. High blood pressure problems. The main drug on the market for that is captopril, originally made from snake venom. A more recent example of that is Ozempic. It was developed from the venom of a Gila monster. There's a lot about venom we don't know, and those things can be used to help us at the end of the day.
Welcome to another episode of the Pause and Effect podcast. Today we're tackling a topic that strikes fear into the hearts of pet owners across South Africa: snake bites. But this isn't just another fear-mongering conversation about dangerous reptiles. We are joined by Dr. Carla Evans, a veterinarian with a unique perspective. She's completing her master's degree on snake bites in dogs, while also working alongside her husband on snake rescue callouts. In this episode, you'll learn the real facts about snakebite management, when antivenom is actually needed, and how to handle snake encounters with your pets, and why the situation might not be quite as dire as you think. Whether you're a vet looking to brush up on your protocols or a pet owner wanting to be prepared, this conversation will give you the knowledge and confidence to handle these situations calmly and effectively. Welcome, Carla. Welcome to the Pause and Effect podcast.
Thank you.
It is so cool. You are newly married, so you have a new surname, but you are you going by your new surname now, Dr. Evans?
Does
it sound strange?
I'm still getting used to it, but it's fun. It's nice being married, and I still need to do the whole paperwork at home affairs kind of thing to change the surname. So but I will do it eventually.
At least it's nice and early in your career. I'm getting remarried, and I'm going to be taking on a new surname. And of course, I've established my career on my ex's surname. So it's very difficult. I probably will continue to practice in my current professional name, and then obviously
just easier.
Yeah, sometimes it is. But congrats.
Thank you.
Yeah,
Thank
you
so
looked
much.
absolutely beautiful, really. So I have asked you today, you are quite special in the work that you're doing. You're doing a master's in snake bites, which is very, very cool. Final year, obviously, I'm sure you're looking to kind of be able to put all that studying and research and stuff behind you. Does it require a final paper?
Yes, so I'm doing my MSc, and we're looking specifically at snake bites in dogs. This is now like I said, my final year of the MSc, but I have been studying for 11 years, 12 years. So it's just the norm for me to be studying. I don't know if I will ever not be a student. And I think as a vet, you are pretty much a student for the rest of your life.
They force us to be with all the CPD we have to do.
Exactly. You have to learn as you go. But my master's focuses on snake bites because my interest and my passion is this intercept between snakes, which I love. I love reptiles and snakes, but I also love, pets, dogs, cats, all of that, and then the environment and the biodiversity. And this is kind of just the intercept of where all of those things come together that's at snake bites, and that overlap and interface between humans, their pets, and snakes.
And you obviously want everybody to live in a harmonious kind of way. And the reality is, because our pets react in a certain way to snakes, and we react in a certain way to snakes, or historically, we obviously, through education, hoping to change that, there is often a little bit of miscommunication, misinformation out there, and a lot of damage can be done. And I'm sure you see the repercussions of that.
Yes, there's a lot of misinformation, as with a lot of different things, but especially when emotional things like our pets and the safety of your pets come in, and snake bites. People are terrified of it and terrified of snakes for that reason, and so it's a very emotional topic. I'm not asking anyone to choose between their snake or a pet. I feel like you don't have to choose, between the two. Both can live their life.
And they can coexist.
Separately. And obviously, yes, those conflict situations does happen. Snake bites is a reality. But I think it's been blown a little bit out of proportion. When you look at actually the amount of snakes and the amount of human snake pet interactions that occur, and how many of those actually result in death of an animal or a person, it's actually quite minimal. It's not that big of a thing that we need to make it out to be.
Yeah.
So, yeah.
So, I mean, let's start and talk about some of the work that you do. I mean, you are a veterinarian, so you are dealing with the consequences, as you say, of those snake bites. You see pets that arrive and you are having to advise owners, and you see that emotional toll, and you see all the urgency and the fear around this topic. But you also deal with callouts in order to now remove snakes from properties, and you work now with your husband to be able to do that in a safe way. What is the general, like, talk us through the typical call that you'll get to come and assist someone who have discovered a snake? What do you generally ask, and how do you approach the situation?
So the first thing we ask is when last did they see the snake, and if they have eyes on it or they know where it is. Unfortunately, once a snake has disappeared, say into the garden, there is almost zero chance that a snake catcher is going to find it. It's gone. It's like looking for a needle in a haystack. And so if someone can tell us, okay, the snake went, for example, into a little Wendy house, or if it's in the house, they know which room it is in and they can close the door. Those sorts of things, that's important to know, so that we know that it's at least sort of in a single area, we can look for it and find it. If someone saw the snake yesterday or 2 weeks ago or 6 months ago, we're not going to come and look for the snake. It's just not going to happen. We're not going to find the snake if it's been a long time. But if they know where it is, then yes, then we go to sort of the next part of the conversation, and that's, what does the snake look like?
And are people able to generally try and ID? Have they taken pictures? Do they correctly ID them?
We get some funny identifications from things like Google Lens and AI sort of generated identities of snakes, which is usually incorrect. So best not to use Google to try and identify a snake for you, because it generally doesn't work that well. But I mean, it's interesting. You get some people that are actually really good at it. A lot of people has had multiple snakes at their house, or multiple black mambas at their house, so they know what they look like by then. And we can kind of tell, okay, this person, we know them, they've had mambas before, so they'll know if there's another mamba at their house. But generally we say to leave the identifying of snakes to the snake experts, because it's not always that straightforward. But generally speaking, if you've got a snake that's as thick as a finger, for example, it's generally one of your harmless snakes. It's unlikely to be anything really, really dangerous. So a thin little green snake with black spots is a spotted bush snake. It's not a green mamba. People often make that. They just see a green snake and people immediately panic because it has to be a boomslang or a green mamba. And chances are it's not one of those. It's probably a little spotted bush snake. I mean, if someone can't identify it, that doesn't make much of a difference. We can still go out and obviously look for it and catch it and see what it is. So generally ask people to keep an eye on the snake, or at least the area where it was last seen. If you saw it go in under a cupboard, just watch the cupboard, for example. If there is an open window behind it, please close it, because chances are they're going to try and escape. That is the main thing a snake wants to do. It wants to escape. It does not want to come up to you. It doesn't want to bite you. It doesn't want to attack you. Don't believe all of that stuff that you hear, the old wives' tales and things like that. So just watch that area, and then until a snake catcher gets there. Look, getting a snake catcher out isn't always a feasible option. If you're in an urban area like Durban, there's a lot of snake catchers around. Chances are one of them will be able to come out. If you're in a more remote area where a snake catcher is not, close to you, generally those people, we do say, it's good to, to learn how to do it yourself. If it's something that you're comfortable, at least open to learning. Generally the majority of snakes can actually be swept into a bucket using a broom. You never have to touch the snake. We definitely encourage people never to touch a snake with their bare hands. Do not grab the tail. People see people grabbing snakes' tails in movies and on videos and stuff. Generally, that's a really bad idea. That's how people get bitten. So do not grab a snake by its tail. do not use your hands. We say to people, you can grab a broom and put one of those big round bins or whatever the case may be on its side, and you just sweep it in there, and then you can just go and chuck it out in the garden or the closest.
Keep that window open and let them
and
go.
just let it go. Exactly. Yeah. These little spotted bush snakes, they are extremely fast and they're very good climbers. And so generally, if you come, with a broom and you kind of like shoo them out, they'll get the first chance they get to go out an open window and disappear. So it's good to be cautious, but it's good to also arm yourself with that knowledge before it happens, because in that moment, everyone is stressed. Everyone in the house is worried. You're worried about the pets. You're worried about you and your family's safety. And so having a number of a snake catcher before you need it, so just having it on the fridge, for example, so that you don't have to stress about getting it when you're in that situation, or just educating yourself a little bit about the species of snakes that you find in your area and more or less what they look like. And then, yes, just, with a broom trying to sweep it out or something like that is generally good.
You look at me, I look at you, I see the love in your eyes.
Health you can see, love you can feel. Ultra Pet, the science of love.
So we're going to talk about snake bites, and in particular, obviously, in pets, because that's something that you've got expertise in, and I have to tap into that knowledge. But often what happens is the pets are going crazy. I mean, I say pets only because my cat has brought a snake in before. So I'm not going to exclude the cats. Sometimes, they come and deliver the gift. But how do you advise owners when there are pets involved?
Yes, so it's interesting that you bring up the cats and the dogs thing, because we do find there's a very big difference in how those two animals handle snakes. Dogs have a natural instinct to protect. They protect you as the owner, and they protect everyone, their house, their territory, their area. They want to protect that. And so that's why we often see dogs getting bitten by snakes, because they see it as an intruder, and their instinct tells them, get this thing away from my house and my family. Okay. And that's why we often see quite serious snake bites in pets, because that's just the instinct. Cats are not as protective of, I think they pretty much only protect themselves. I mean, I've got my two cats, I love them to bits, but I wouldn't say they care about your safety as much as they do their own. That's just how cats are. So they don't have that strong instinct telling them that they have to kill this snake in front of them at all costs.
Yeah.
They just don't have that. When cats interact with snakes, it's more coming from a place of curiosity, and that's just like that hunting instinct, and they're more playing with it than anything else.
Yeah.
And for that reason, we don't see a lot of venomous snake bites in cats at all. It really rarely happens. We have had some. We have had a cat bitten by a very small little hatchling green mamba, and we think it's because the cat was mistaking it for one of the smaller harmless snakes that they normally play with, because it was so small. Generally, cats tend to leave bigger dangerous snakes alone. I think they just know that I'm out of my depth, and kind of give a step back. We often go to black mamba calls where black mambas have found refuge somewhere, and the cats in the house will kind of sit around that area and they just stare. They look at that area and they just stare. They don't do anything with the snake. So it's quite interesting. But yeah, I mean, the main thing to try and remember is that both animals are acting purely out of instinct. There's no malicious intent from a snake biting the dog, and there's no malicious intent from the dog biting the snake. It's purely instinct, both animals trying to survive, essentially. And so it's really sad when it does happen where a dog gets bitten, but it's not really anyone's fault. It's just nature. It's just how it is. So the main thing is that if you see your dogs interacting with a snake, any snake, is to try and get them away from the snake. We've had cases of people filming it. So they just kind of get their phones out, take a video of their dogs, essentially killing a black mamba, and 5 minutes later, all 3 dogs are dead. So unfortunately, that does happen. And we're not expecting you to get between your dog and a black mamba, but you have to try and get them away. Just for the sake of their own life, you need to try and get them away. And we usually say that by either, sometimes you can break it up with a hose pipe, just with water, just cold water, shouting, anything you can do to just at least try and give you that gap where you can just get them away from the snake.
So take your dog, put them somewhere else, lock them in a room.
Lock them up,
totally
get them away. Whether it's a venomous snake or not, no one needs to die. The snake doesn't need to die, dog doesn't need to die. Just separate them as much as you possibly can. And then obviously, if your dog has been bitten, obviously you need to address that. That dog needs to go to a vet. And then with regards to the snake, you can phone a snake catcher, especially if the snake has been injured. If it will most likely just try and get away as soon as the dog is gone, and you might never even see it again. But if the snake is very clearly injured, it is good to get a snake catcher out so that the snake can also get care if necessary, because it is an animal and that has been injured and in pain, and all animals deserve to be looked after and cared for if necessary.
And relieved of suffering if that's the ultimate goal.
Exactly,
Yeah.
yeah.
So how often do you find that situation where you are, dealing with, obviously advising on the dog and advising on the snake? Because, like you say, you're an advocate for both and you care about both.
Yeah. Yeah, it's I think people have this very inherent need to pick sides. People love doing that. They love supporting one, and then that automatically means that they are kind of fighting the other. And I think we must kind of take a step back from that. It's a natural reaction we have, but it's not helpful in this kind of situation to say, well, the snake needs to die, the dog needs to live. That's not really helping anyone. In that situation. So yes, I mean, both can live, both can have their own life, and hopefully never interact, and that's fine, So yes, you do deal with, and I mean, I don't blame people that have lost a dog or even a family member to a snake bite. We're not asking people to love snakes. No. I know that's not going to happen, and I don't blame people for not liking them.
But you want them to be respected.
Yes, at least I just want people to understand that they have their place, they have their role in the ecosystem and in our world, and so it's best to try and find a way to live in harmony with them, because they're always going to be around. That's just how it is.
Tell us about their role. I'm interested.
It's a very interesting discussion to talk about that, because we can speak about the role that snakes have in the ecosystem. I mean, obviously, they are fantastic predators. They eat a majority of our what we would consider pest animals. So rodents, a big problem, especially in Durban. So rodent populations can be kept under control with snakes. Yeah. So that's one very important one. They're also a food source for other animals. So if you're thinking of like the genets in your garden, your birds of prey, for example, they will all prey on snakes and rely on that as a food source. So they're also helping other wildlife that we may like a little bit more because they're a bit cuter and fluffier. So it's also an important important thing to think of. The other sort of perspective that we can look at is how snakes can actually directly benefit us as humans. And this is something that it blows people's minds, but I always say when we're doing snake awareness talks that snakes have saved a lot more lives than what they have taken. Everyone in South Africa knows someone that is on blood pressure medication. It is probably one of the most prevalent conditions in South Africa is high blood pressure problems. And the main drug on the market for that is Captopril. Captopril and all its derivatives that came after would not be on the market if it weren't for snakes, because it was originally made from snake venom. So a scientist at some point realized that during a snake bite, blood pressure drops. And so they've managed to find the ingredient, the chemical in certain snake venoms that are responsible for that, and they've managed to make that in a lab, and that was used to then make captopril. And so, it's I don't necessarily like looking at animals only from the perspective that if they're useful to us, we should respect them, because I think they just deserve respect, regardless of what they can do for humans. But it's one way of looking at it, is that there's a lot about venom we don't know, and there's a lot about venom that we're still learning, and those things can be used to help us at the end of the day. A more recent example of that is Ozempic. Everyone knows Ozempic, okay? It's the big new drug that's helping people lose weight, and it's actually originally a medication for diabetes. But it was developed from the venom of a Gila monster. So it's incredible. I mean, they're working on medications. There's actually drugs on the market that are FDA approved. I think there's now about 6 drugs on the market FDA approved that originated from snake venom. For blood clots, major medications that are used to break up blood clots is from snakes venom that break up blood clots. So, or that inhibit clotting. So that's, all FDA approved stuff.
Fascinating. I had no idea. You're right. Mind is blown.
Yeah. That's
incredible.
Cool. I love that. Hey? It's like the funnest fact ever.
Excellent. It's the take-home message of the day. So one of the things, obviously, in the work that you're doing in your master's is discussing the bite. Now, I am an Edinburgh graduate, so it wasn't a big part of my syllabus when I was studying. And of course, coming to South Africa, and dealing with the reality of snake bites. And for some reason, I feel like we've actually had fewer cases over the last few years, and it'll be interesting to get your perspective. But the initial thing was, the first issue for me was the ID of snakes. I just felt people were really bad, including us vets. It was very difficult to ID unless the owners brought the remnants of the snake in, and I want your perspective on how best to try and get that. But also then the management of these snake bites. And I feel like some things have changed. We've learned a lot. And before I tell you how we used to do it, I would love us just to discuss the do's and don'ts, from when to treat, when to use antivenom, and for owners who are listening to understand the cost associated with that care, because that is often they're emotive because their pet's been, but then the actual treatment of it, they are horrified.
Yeah, it's very, very expensive. Yeah.
So how do you approach that, especially in terms of if, you do a lot of emergency work and you see it from that side? Obviously you assist with some of the management in the house, but you will be here and you're presented with a case. What is the thought process?
So all snake bites, and this counts for human bites on humans and bites on pets, it's treated based on the symptoms. So when we have a patient in front of us, we look for pretty much, we like to classify them into pretty much 3 different things, okay? The first one is weakness, so progressive weakness, basically signs of paralysis, okay? So that's the first major symptom that you can see in snake bites. Yeah. And I'm talking just in general now, okay? You've got your patient in front of you. The second is swelling, severe progressive swelling. And the other one is uncontrollable bleeding. So as a vet, we look for one of or a combination of those 3 things. So the whole point of using what we call that a syndromic approach, and looking at one of those 3 things, is so that we don't have to rely so much on the identifying of the snake itself in order to treat your pet. So back in the day, yes, it was always said that you should take the snake with you to the hospital so they can identify and they know what to use, what antivenom to use. So we've moved away from that, because by just looking at the symptoms in front of you, you can pretty much know exactly what to treat with, regardless of whether you know exactly what snake it was or not. We find that when people need to bring a snake to the hospital, you're just endangering more, you're just endangering more people's lives.
And then they come dead. Because that's also the difficulties, because the only way to transport them is to kill them. And we don't want that.
Yeah.
And I think that was the approach historically. They were like, okay, I now need to kill the snake, like you say, endanger yourself, but also the loss of a life.
Exactly.
Awful.
Yeah, so that's not necessary at all anymore. We've completely moved away from that. So yes, I mean, if you can get a photo of the snake, fantastic. If you can't, it's not going to mean that your animal is going to die, because we don't know exactly what snake it was. So we've moved away from that completely, which is great. So we look at the symptoms, and then from there on, we decide whether we are going to give antivenom or not. Okay. The majority of snake bites are dry bites.
Really?
So about 60% of snake bites are dry bites that do not require any antivenom. So a dry bite is a bite where no venom is actually injected. So the snake bites, but no venom is injected. The snake can control whether it gives you a dose of venom or not. Cases where we do see quite large amounts of venom injected is generally when the snake is in pain and when it feels its life is significantly in danger, where if they do bite, then they will inject quite a large amount of venom. And those are generally your cases where people are trying to kill the snake. So that snake is in pain, or it's been bitten by a dog, for example. If it gets a bite, and it's going to give you a good dose of venom. So when it's more a warning bite, so a case of, you've got a snake in your house somewhere, you accidentally, put your hand in behind a cabinet to try and get something, and they give you a bite. Generally, those bites are warning bites, dry bites, and you would not need any further treatment. Of course, we don't know. You don't know immediately whether you've gotten a dry bite or not. Even more so with a pet. You don't know because they can't tell you that it's burning, or I'm not feeling so great, I'm feeling like a little bit wobbly. They can't tell you any of that. So yes, you should still go to a hospital and take your animal to a vet if you suspect they've been bitten, because we need to monitor and see where the symptoms are going to develop. But the majority of cases are dry bites.
And are those painful?
They can be if it's a snake with quite big teeth. So it could be, could draw a little bit of blood also. But generally it's a very quick, painful while the bite's being inflicted, and then after that, no pain after that. Yeah.
So these are not, like, irrespective of what's happened, they need major pain relief and that kind of stabilization?
No, generally not. Your snake bites that really are quite painful are your mole snakes and your pythons. Those are big snakes though. I mean, you're gonna be able to tell someone that it was a python because pythons are big. Okay. So yes, they have quite sharp teeth. However, both of those snakes don't have venom. So the bite itself is painful, but they don't have venom glands. They don't have fangs. They have teeth to hold on to prey, but they don't have those two fangs that everyone, always thinks of when you think of a snake's mouth. And so, yeah, you may need some stitches if it was a proper bite, but no any antivenom or anything like that. No.
Okay. So the dog is presented. Owners are in a complete panic. How do you manage the situation? And I suppose I'm going to ask you to start with the kind of communication you give the owners, because I think that sometimes, and I'm talking for myself, often there's just this desire to kind of separate owner from pet so that we can just get on and do what we need to do, particularly if you're noticing some of those signs are now becoming progressive. How do you approach it with the owners?
So generally I will tell owners, listen, best thing to do is going to be to admit that dog in hospital. Regardless of what we're going to be doing, it is best for that dog to be with us for at least the next 24 hours, because we do have some venoms that can develop quite slowly and they work quite slowly. It's not going to be something that's necessarily obvious from the get-go. And so it's good that it's better for us to admit that dog in hospital and observe and see what's actually happening. So from the get-go, that is probably a good idea if you are able to get your dog admitted. And then, yeah, I mean, you obviously, we need to also try and calmly communicate so that everyone just takes a breath. You do need to, when it comes to any emergency, but I find especially with snakes and working with snakes, everyone just needs to take a breath as well and just try and calm down a little bit, because that panic and that fear, you can't make rational decisions when you are panicking. It's just, we can't, as humans, we just can't do that. So everyone just needs to relax sometimes and just, woosah. So then we get our full history from a client. Did you see the snake? What did it look like? What was the sort of, we'll often say, you'll often hear that people say the snake was spitting at the dog. Then we know, okay, it's most likely a spitting cobra. In those cases, often you'll see the swollen eyes because that venom goes into the eyes. It causes significant pain, but it's generally it's not life-threatening if it just got into the eyes. Obviously, if they bite the dog, that's a different story. But at least now you've kind of got an idea of what actually happened and what maybe more or less what snake we're dealing with.
Yeah.
So a good history of what the owners saw is a good place to start. And then, we need to prepare that owner for the probability that if we need to administer antivenom, if it's necessary, when we see, one of those three syndromes that we spoke about, and we can see it's progressing quite rapidly, that antivenom is a likelihood, and you need to discuss the costs of that. It's a very expensive medication to give, and it is often also a problem with actually getting the antivenom itself. There's been quite a few problems over the last couple of years with the supply of the South African antivenom. Luckily, it is back in stock now, so your hospitals, your human hospitals and your vet practices, some of them do carry it and it is available, but there has been problems with its supply over the last couple of years. But you need to prepare owners that, yes, we may need to give that, and this is what it's going to come down to, essentially.
And cost of that antivenom relative to the size of the pet, or is it relative to the clinical signs and for example, the swelling?
So antivenom is one of those few medications where the size of the animal doesn't matter. It's all about the amount of venom that was injected. And you need a certain amount of antivenom to neutralize the venom that was injected. So whether it's a small little Yorkshire Terrier versus a large Great Dane, they are going to get a sufficient amount of antivenom to neutralize the venom that was injected, and that's it. So you may give in a milder bite on a Great Dane that was bitten by, for example, a puff adder, but it only has a little bit of mild swelling, and we give 1 vial of antivenom to that dog. Whereas if a smaller dog was bitten by a black mamba, for example, and they're showing quite severe signs, we might give 4, 5, 6 vials of antivenom, even if it's a small dog. So the size of the patient doesn't matter so much as the amount of venom.
So you're treating the clinical signs. You're not treating the size of the patient or their body weight.
Exactly.
So in terms of the other stuff that you do, I'm just trying to think through, they arrive, they're on the table. Is the first thing you do is get IV access? Do you always put a catheter in and you're ready?
Absolutely.
Do you ever start fluid therapy? Is there a benefit to IV fluids?
Yes, so I would say so. If it depends a little bit on the symptoms that you're seeing. You also don't want to fluid overload a patient, because we do find in these, for example, in these neurotoxic snake bites, they lose the ability to swallow. And so fluid is going to build up in numerous places in the body. And so you don't want to fluid overload them either. But yes, definitely IV access is important, because if you want to give antivenom, it has to be given intravenously. And you want to be able to start that as soon as possible if necessary. We also give other IV medications like atropine to break up the secretions that build up. The black mamba patients often hypersalivate quite severely, and so the atropine can help with that. So there's a whole bunch of different things we can give if we've got IV access at least. Should
you be treating snake bites with antibiotics?
So this is always a bit of a controversial. So generally, no. It's not.
It's not like a dog bite.
No, it's not like a dog bite, or a snake's mouth isn't necessarily a dirty place and we need to treat for, bacteria that enters the wound. That in that sort of way, no, we don't need to give antibiotics. The antibiotics become a bit more of a necessity if, for example, you have aspiration pneumonia, because the dogs that are bitten by, for example, black mambas, Cape cobras, your neurotoxic snakes, they often vomit quite severely. That is often one of your first symptoms that you see, severe vomiting. And because they are struggling to breathe and they are struggling to swallow, they can often aspirate and get vomit or saliva into the lungs. And in that case, yes, of course, antibiotics are indicated. And then when you're looking at bites like from your cytotoxic snakes, like puff adder bites, generally, even though you can see a level of tissue necrosis where tissue actually starts dying off, generally those wounds are actually fairly clean. It's quite interesting, but there's been a few theories or some research being done on that, and it's actually been shown that the saliva, so snake saliva in many cases contain antibacterial agents. So generally the bites don't really result in a secondary bacterial infection just from the bite wound itself. One of the reasons why they think that saliva of snakes have antibacterial properties is that so that when they swallow a prey item, that item doesn't decompose as quickly as it's going through the snake's gut, because they do tend to digest food quite slowly because they are ectotherms. And so there's quite a few different theories as to why that is, but there is actually some level of antibacterial action in snake saliva, which is quite interesting. Often when these wounds, these cytotoxic bite wounds that turn a little bit necrotic, they actually heal really, really well on their own. They do really, really well. The other indication for antibiotics in your snake bites is that in these neurotoxic bites, you often see a case of severe, what we call a shock gut, essentially. So they often have this severe diarrhea. And in that case, yes, you can have that translocation of bacteria actually going into the bloodstream. So in that case, yes, you would also want to then do a prophylactic antibiotic.
So it's the one time in vet medicine that if you see a hemorrhagic diarrhea, you can
you actually would reach for your antibiotics. Yes.
Yeah. A lot of talks about us, misusing antibiotics, which is why it's an important conversation. Now, the other question I see asked on a lot of these vet groups is steroids or non-steroidal anti-inflammatories. Can you advise us on that?
So it's in many cases contraindicated to do non-steroidal. If you're looking at the analgesic effect of it, it is probably better to go with your paracetamol or actually an opioid. But ideally, you don't want to be suppressing the respiratory function either. But generally, non-steroidals can actually be contraindicated in snake bites. We do find, especially in your smaller dogs, in cytotoxic bites, so often in puff adder bites in small dogs, that causes quite a significant amount of kidney damage. And so your non-steroidals you want to sort of stay away from if you've got that risk already there for kidney involvement. So generally, not really something we reach for. Steroids as well, not really something we see as in any way useful in snake bites. So it's interesting because you also don't want to do nothing.
Yeah, and you want to feel like you're managing the inflammation. So I understand why there's a desire to do something because us as vets we're thinking, okay. How we want to obviously manage the discomfort because it looks terrible. They clinically look so sick.
Yeah.
But also, you seeing an inflammatory response and you're going, well, should I be counteracting or is that something that should be left to kind of manage itself?
Yeah.
So
yeah, I mean, I think the main thing that we must just remember is that your mainstay of treatment is always going to be antivenom. That's always going to be your gold standard. All the other things are extras, and it should always be stressed to owners that the best thing you can do is to get that dog antivenom. That is just always going to be your gold standard. But with regards to managing the inflammation, managing the pain, we do find that in your cytotoxic bites in dogs, they often get bitten around the neck or the face area, hence why we see those big swollen faces. And yes, it is painful, but we've also found that it's not necessarily as painful in dogs as it is in humans because they've got a lot more room for swelling than what we do. So a dog's subcutaneous area is very big. That's the kind of the whole point of this, dewlap area in a dog is when they get into fights and things, it acts as a bit of a buffer, that extra loose skin that's there. And so there's a lot more room for swelling. It doesn't form a compartment syndrome like it would in a human. They've got a lot of room, and so that also helps that it's not so painful. Whereas in a human bitten on the hand or the hand or the foot, for example, by a puff adder, it's incredibly painful because there's just not that much room for swelling.
I mean, I must say, I use a similar thing when you've got a vaccine, a pet that comes in for a vaccine, and the kids are like wide-eyed, going like, oh, and they go, but no, when I got an injection, it's so sore, and I try and explain to them, like your injections are sore because you don't have all the skin. So very much in a similar way, giving a subcut injection versus
very different.
I think we can all sort of associate with the discomfort of an injection in our arm or in our glute, so. Yeah, such an important point. So they look visually awful, and you've got to manage owners' expectations of that, but you've got to also reassure them that giving something like an opioid will suppress them, and actually it's, in that sense, contraindicated. So in that same breath, are there any cases that benefit from oxygen?
Yes. So I mean, that is our, if you think about your ABCs, the general, you need to maintain an airway, no matter what. And if you've got a dog that's got a severely swollen neck region, that airway is compromised to a certain extent. So yes, that is something that I would be quite worried about if you've got severe swelling around the face. If you find that you can see that this patient is decompensating a little bit, they perhaps turning cyanotic or pale or anything like that, then yes, some additional oxygen is not going to do harm. It might definitely help them.
And is that better nasal, or is this sometimes where you're actually doing a tracheostomy? Are you going to that kind of route, or do most of them stabilize just say an oxygen tent?
Yeah, I would say oxygen tank would probably be your first kind of
but it's not like the swallowing a bee and getting laryngeal or that kind of swelling. This is very much of the tissue, so it's not always, it can occlude a little bit and make it more difficult, but it doesn't generally cause swelling of the...
Yeah, generally I think it's more the mass effect of this the subcutaneous swelling that we see that's actually occluding the airway eventually.
And how often are you needing to place things like feeding tubes? I mean, does the swelling settle fast enough for them to resume eating and being able to sort of maintain their own nutrition?
Yeah, I find that dogs recover really, really quickly. Even if they don't get antivenom, in a situation where the owners just can't afford it, or it's just not available, it's out of stock, or whatever the case may be. Generally, dogs can recover really, really well if they can just get over that initial insult to the system. But yeah, I mean, generally they do resume their normal kind of activity after 2 to 3 days. But it depends on what you have in front of you. I mean, you do get those patients that just really struggle. And then, yes, a feeding tube would probably not be a bad idea. I mean, you don't want them to be starved either for an extended period of time.
I mean, we have seen some cases, so I agree with you, the majority of the snake bite cases I've seen have been affecting the face, the neck, sometimes the forelimb, but ones that affect lower limbs. Discuss what can happen in those sort of situations, particularly if there is an antivenom available, and how that would look.
Yes, a bite on a limb, there's not that much room for swelling. And then that would be a lot more painful. And yes, it could lead to a compartment syndrome. Generally, because these venoms are quite short acting, we at least try and encourage vets to hold off on doing something drastic like a fasciotomy. We try and hold off on that for a good couple of days, because we do find that they actually come down and recover really well without fasciotomies pretty quickly, and you're introducing a lot more risk with fasciotomies. Generally, they are not necessary. Generally they do come right within a couple of days on their own.
That's good. Let's talk the cost associated with this. When you are giving a cost estimate, and I know this has got to be a broad range, it's a bit like how we operate in this place. We give it could be this, it could be that. What kind of figure are you giving owners here in South Africa or here in KZN when you are in those initial early stages, just to manage expectations?
The idea is always to give as much antivenom as what the owner can afford. So if the owner can afford 1 vial, give 1 vial if you have it, because something is always going to be better than nothing. So it's always it's a conversation with the owners as to what is feasible for them. So if they can afford 1 vial, 2 vials, then give that, and you give as much as you can if it's a severe bite, and you want to give it as soon as possible after the bite as well. But I would say generally you're going to be paying for overnight hospitalization, IV fluids, pain medication, your antivenom if that is a feasible option for the owner, and then all your adjunct things like you said, like feeding tubes, for example, if it does get to that. So the massive costs come in when you've got a neurotoxic bite and that dog needs to be intubated and ventilated. So ventilators are not straightforward things to set up, and it is very expensive to have a dog on a ventilator.
Yeah, they're going to be monitored constantly.
That is ICU care, and that is going to probably be one of the most expensive things that they can do if necessary. But I would say if there's not going to be ventilation involved, I would say you're probably looking at anything from 12 to 20,000 rand. If it's quite a straightforward giving, few vials of antivenom and hospitalization and all of that, you're probably looking at around the 20,000 rand mark.
Yeah. I mean, and this is often the example we give when we're saying to owners about any insurance conversation or discussing, the means to be able to afford vet care, is we use the example of hit by cars and discs, or hip replacements, and then snake bites, because it can become very expensive, often at a time where, you're just, not anticipating having to fork out that kind of money. And it's scary. And the reality is, from a prognostic perspective, you don't know until you tried. So how do you deal with that conversation in terms of managing expectations for an outcome?
Yeah, so it also definitely depends on how the animal is presenting to us. If you've got an animal that is severely flat, they are struggling with, just keeping their head up, struggling with breathing, those sorts of bites. I mean, you need to prepare an owner that we could have an outcome where either the dog does pass away eventually, despite all of our efforts to treat, and so that is an option. The other possibility is that we might treat the dog, and they might just never really recover enough, and we end up having to make the decision to euthanize anyway after a couple of days of trying, where their body just cannot take it, and it's just complication after complications, because there's so many things that can creep in. I mean, we spoke about the aspiration pneumonia earlier. Aspiration pneumonia is really serious, and that can be something that eventually leads to their death. So it's important to manage that. And if you're looking at something like a worm slung bite, for example, we haven't mentioned the worm slung bite. Worm slung bites are difficult because the antivenom is very difficult to get. Yeah. We only have 2 types of antivenom in South Africa, essentially. One covers for 10 cobra and mamba species. It covers all 10 of them, and it's all in one antivenom. Hence why we don't really need to know exactly what snake bit the dog, because if we see those symptoms we spoke about, we can use that polyvalent antivenom. And then the other antivenom is your monovalent antivenom, which is your worm slung antivenom. That is very difficult to get.
And we've kept it here before. I'm going to, do not hold me to this. I'm sure like my listeners will be like, no, it's not the case. But like 10,000 Rand cost to us.
Yeah.
And it expired. I mean, I was disappointed it expired, but I was pleased it expired because it meant we didn't have to use it. But you cannot keep purchasing that with, they just, it's not sustainable.
It's extremely expensive. Worm slung antivenom is incredibly expensive. Part of that has got to do with the venom yield of a worm slung. They have an extremely small venom yield. And so you need so much more of that venom to actually make this antivenom. I mean, just to put it into perspective as well, everyone's always worried about the mambas and the cobras, and yes, they definitely have a lot more run-ins with pets and humans, absolutely, and that's why people are so stressed about them. But they're actually not the most venomous snakes. Your worm slung's your most venomous snake in Africa. So drop for drop, they have the most potent venom, and so their antivenom is incredibly difficult to make, and it is very expensive. So most of your vet hospitals don't carry it. It's just not feasible. And so those vials of antivenom for worm slung bite need to be purchased then from a human hospital that keeps it. And they're often not as eager to part with their worm slung antivenom because they're sitting with the same problem of, okay, they're not keeping a lot of it in stock anyway, because it's not something, if any. Yeah. Exactly. So if they even keep it, they don't have a lot of it because it is so cost prohibitive and difficult to get. And so if they now hand it over to a vet's hospital or any other human hospital, whoever, and they get a worm slung patient tomorrow, what then, So yes, it is an extremely, extremely difficult antivenom to even get hold of. So in those cases, we often tend to just treat worm slung bites symptomatically. They do lead eventually to quite a catastrophic DIC. And so you have to try and manage that bleeding tendency. And that is very, very, very difficult to do. Worm slung venom is very long-acting, slow-acting venom. So we sometimes see bleeding only starting like 2-3 days later after the bite had happened. So the sooner an animal can be hospitalized and monitored for those sorts of things, the better, because it can sometimes take quite a while to develop.
That's so interesting. Yeah. So often people are not seeing the initial signs, and they're very reluctant to say, allow us to admit their pet, but it's so important in every snake bite to be able to just monitor.
Yeah. It's also quite interesting that look, there's no test that anyone can do to test for the toxin or the venom. We can't take blood and tell you whether your dog has been bitten by a cobra or a mamba or whatever the case may be. There's just no such test. What we can do if we suspect that there's been a bite by a worm slung or, for example, a vine snake, your hemotoxic snakes, it's actually quite straightforward to just do a whole blood clotting time. Literally just take a bit of blood in a normal serum tube and see if it actually clots after 20 minutes. If you've got no blood clotting happening, then you probably know you're already entering that stage of of severe bleeding that's going to start at some point.
And the management of that, is that blood transfusion?
Pretty much, yeah. If you can't get hold of worm slung antivenom, your transfusions are going to be your next. Yeah. And they, you do get dogs that survive worm slung bites. There was one treated about 2-3 weeks ago on the north KZN coast, and it did survive. That being said, it was a very large bull mastiff. So the bigger dogs tend to survive your snake bites better than smaller dogs, just because you're spreading that venom into a bigger body. And so that dog did did luckily survive. But we don't see that many bites of worm slung in pets or humans for that matter at all. So luckily it's,
I mean, you spoke about obviously the DIC consequences of these severe bites and particular bites. How important is blood testing? Is that something that you generally add on if there's any deterioration to just understand whether there's any underlying, say, renal issue, or like, do you get any other beneficial information from running bloods?
Yeah, I think I would say just getting a basic understanding as well of that dog's underlying health kind of condition is obviously always a good idea, and to have a baseline to then compare future blood tests too and actually see what's going on. We did mention the kidney damage earlier, where in your cytotoxic bites, like your puff adder bites, we do often see quite severe kidney involvement. And we've seen dogs die from kidney damage later down the line due to snake bites. So yes, that is something to monitor and keep.
One of my final questions, because I've put you on the spot a lot today. When do you not use antivenom? Because the other information that we get as veterinarians is obviously you don't want to be using antivenom if it's not indicated. So how do you know that the swelling is not just normal, dry bite swelling? Like, there's obviously always this risk of kind of treating too soon and using antivenom when it's not indicated.
Mm-hmm. Yes, absolutely. So the two species of snake bites that I often find myself like, if from a veterinary perspective, if you don't have the snake in front of you, and obviously a dog can't tell you what snake bit it, and we've spoken about the fact that the exact identity of the snake isn't really that important. The one part where I do feel like it can get a bit difficult is with your night adder bites and your stiletto snake bites. So it's important to note that your polyvalent antivenom does not cover stiletto bites and night adder bites.
And night adder bites can look
massive. Very, very. In a human, it's easier because the swelling tends to be, quite mild. It gets painful, but it's not the same type of swelling you would see in a puff adder. You would very clearly see in your human patient, they'll obviously also tell you what the snake looked like and all of that, but you can tell from the presenting signs that it was a night adder rather than a puff adder, for example. In dogs, that's not that easy, especially in areas where your distribution of your puff adders and your night adders overlap. Because in a small dog bitten by a night adder, you would see severe swelling. And if you don't know the exact snake that bit this dog, also often, important to note that a lot of people will identify a night adder as a puff adder because they do look a little bit similar. That is difficult, and I actually don't have the 100% an answer on that, because that is something that we struggle with as vets, is that, do you now reach for your polyvalent antivenom if you're not sure? And you know what? If it's a situation where there's really no way of confirming the identity of that snake, and you've got your patient in front of you with severe swelling and
looking like they're deteriorating as a result.
Exactly.
Which could be night adder or puff.
Exactly. Well, at the end of the day, if you don't give the antivenom and they do pass away, you're probably going to forever feel like you should have just given the antivenom on the off chance that it could have been a puff adder instead of a night adder. If the owners can afford it and you explain to them, listen, I don't know exactly which one of the two this was, and so it might not work. But if they're willing to try and give it a shot and use your SAVP antivenom, your polyvalent, and to go for it, it's not going to do any harm. It's not going to... it's not the chances of something like an allergic reaction is quite a big problem in human patients, but in dogs we don't really see that much of a risk of an anaphylaxis to the antivenom.
Interesting.
And so if that benefit outweighs that risk, if you've got a seriously ill patient in front of you, you know what, it might be your only opportunity to at least try.
And you want to make the right call.
Difficult. Yeah, it is difficult.
So this is, again, just, communication with owners, explaining when they're calm, because trying to take on the information, like you say, in the event of dealing with this is frightening.
Also, something just to add to that is that as a vet, if you're trying to identify what snake bit this animal, whether you have a photo or whether you just have a description or whether you've got none of those two and you've just got an animal in front of you that was bitten by a snake, probably the most overlooked but at the same time the most useful tool that you can use to figure out which one of the snakes it was is to look at your distribution maps. People forget that, so they always ask about the color of the snake or like what patterns it had or whatever the case may be. But we have to remember that every animal, but every snake has their little distribution area in the country. And if you're far outside of that distribution area, chances are, it's probably not going to have, it wasn't the responsible species. So distribution maps are important. If you think about puff adders, we get them, just now speaking from a KZN perspective, you get quite a lot of puff adders and puff adder bites by extension in the Midlands and like from the upper highway area onwards, but they're not on the coast. So, like for example, we are in Westville, Durban North, those sorts of areas, there are no puff adders there. So if you've got a dog there presenting with severe swelling after a snake bite, well, you're sitting with a night adder bite or a stiletto snake bite, probably not a puff adder. So it's important to know your distribution.
Where can you get those? So
you can get those. There's the free app, that ASI Snakes app. I don't know if you know about it.
I'm going to find it now.
So it's a free app. It was developed by the African Snakebite Institute, and it's basically like having a little snake guide in your pocket on your phone. It's got all the information about every snake that you actually get in South Africa. What's quite useful on that app is that it uses your location from your phone, and it can tell you what species you get in your immediate area. So it will tell you don't have puff adders in your area or whatever. It just uses that. You go to local species and it just tells you what you get.
So you could check your client's address and say, you've traveled from Westville, used as an example. It's very unlikely that this is a puff adder.
Yeah, exactly. And you can use that anywhere in the country. So if you go on holiday or if you're working in a completely different place with different snakes or anything like that, you can just use that and it can tell you what you've got in your area.
It's incredible.
Quite useful.
So obviously you do a lot of social media content. You put stuff out there in terms of the work that you're doing. Where can people find you and follow you?
Yeah, so look, probably the best place is actually Nick's page, just because all of our stuff that we do with the snake rescue work and also to an extent the veterinary stuff, and be that treating dogs that have been bitten by snakes, but also treating snakes that have been injured by pets or anything else. So Nick Evans Snake Rescuer page, that's where we put most of that stuff. And that's both on Instagram and on Facebook. Yeah,
it's incredible. Well, the work that you're doing is phenomenal. And I know we could have covered a whole host of areas around this topic because it's vast. I would love at some point for us to discuss managing snake injuries and snake issues. We know like you're dealing with things from mouth rots to impactions to lacerations to all sorts of things, which is fascinating to follow. And I know that there's a lot, us as general practitioners, just we don't get exposure to, and a lot of us are very fearful that we're handing on to you. So very, very grateful for the work that you're doing, particularly in the conservation area. Because I think we're all getting a better understanding of the importance of respecting creatures great and small. So this is brilliant. It's been very informative. I've learned a lot.
Thank you.
Thank you so
much.
Carla.
It was awesome being here. Thank you.
Thank you so much for tuning into today's episode on the Pause and Effect podcast. If you found the discussion helpful, please like, share, and follow our podcast. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Jackson the Jack Rossi here, and boy, am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Oh, how quick can I get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Gets it all to your door.